A 77-year-old patient comes into our office and says, my bite is off. I had a fixed bridge placed by my general dentist about 4 months ago. He keeps on adjusting the bridge, and the bite doesn't feel any better. I take a look at him, take a look at the bite, and then I look at something else and find a potential answer to the problem. And it's not his bite. Find out what it is on practical treatment planning. So this is a patient that I had seen apparently many years ago. He saw a good general dentist, had a fixed bridge placed. It was on teeth numbers 18 through 20. You can see it here. The bridge is doing okay. It's fine. Now, what's the first thing we do? Of course, we do the full examination. I'm going to do a periodontal examination. I'm going to look at everything, including the bite, and I want to see which teeth are touching and which teeth aren't. And I do that with shim stock. So I'll check each contact with shim stock in order to be able to get a registration as to what teeth are touching. In addition, I'm going to look at his entire opening. How far can he open? Because I want a record of that. Okay, so I have that. I check that out, and the bridge seems, there's some teeth that aren't in contact, and his front teeth don't touch, and so I'm seeing some back teeth touching and some back teeth not touching. You'll see that on the chart here as far as what teeth are touching. Now, this is something that you may have experienced before. I've certainly experienced it before, so let's talk about this. The next thing I ask the patient is, how's your neck? So what do you ask about that? So, well, there can be a relationship between neck problems, back problems, and jaw problems and muscular problems. He said, well, I have ankylosing spondylitis. Well, that's interesting. Well, how are you treating it? Are you seeing a physical therapist? No. Are you seeing a chiropractor? No. I'm just doing the best I can. And he's trying to stay off medication as much as he can as well. The next step that I take when I find that out, or even when I don't find that and I see a bite problem, is what? I check out his cervical vertebrae. I'm not a chiropractor. I'm not a physical therapist. All I do is to place a little bit of traction and place traction on the back of the head. I just pull back a little bit, and then I ask him to tap his teeth together and see if it feels any different. It does. Now, if I'm really checking everything, because there is a relationship between the spine and the jaw, I know that's controversial. Some dentists are looking at me and saying, you did what? Yeah, I did. Well, the next step I'll take is I'll have my assistant pull the leg and see if the bite changes, because you can have a problem in your lower back and it'll change the bite as well. So she pulls his leg just gently and he taps, and it doesn't make any difference at all. So we find that I apply cervical traction. It does make a difference to his bite. I check that out again. And by pulling on the leg and changing the position of the pelvis in whatever way, it doesn't affect it. Okay, there are much more definitive ways that physical therapists and chiropractors do their work. So please don't look at this as the entire treatment plan. We'll talk about that. The next thing I did was go into his oral musculature, and I palpated in my opinion, the three critical muscles: the internal pterygoid, the external pterygoid, and the temporal tendon on each side. And I did that. And I found that the temporal tendon, the internal pterygoid, and the external pterygoid on the left side were tender. And the temporal tendon on the right side was just a little bit tender. What's the next step I take? I'll massage those muscles. Okay, so I'll put my fingers in the mouth. I'll massage each of them one by one, and as I do it, I check the bite. I also will check the interoral opening to see if he's able to open more as a result. So I started on him with the temporal tendon on the left side. I then went into the internal pterygoid, which is just in front of the pharynx. It may seem like a gagging area, but if you touch it right, it'll be okay. And then finally, the external pterygoid on the left side. And then I do the same thing to the temporal tendon, only on the right side. Then I check the bite out again. And what did we find this time? Notice in the pre-massage treatment, if you will, tooth number 13 was not touching. After the massage treatment, tooth number 13 is touching. Okay, so what do we know? We know that the entire musculoskeletal system is not at rest. It needs some help. And before we do any bite adjustment, what we want to do is to get maximum improvement in the cervical vertebrae, the cervical musculature, and whatever else is associated with that before we do anything else to the bite. I have a number of chiropractors I work with. In this case, we wanted to work with an upper cervical chiropractor, and he cannot tolerate adjustments, and so we have an upper cervical chiropractor who actually does adjustments by sonar. There's actually a sound wave adjustment that can be done in C1 and C2 in order to be able to reset that. So I'm sending that patient to that chiropractor. Let the chiropractor do her work, get maximum improvement that way, and then take a look at the patient. Let the patient determine whether the bite is comfortable or not, and then we can decide whether bridge work needs to be adjusted or replaced or whatever, okay? So what's the lesson here? A bite is not always a bite, and the bite, in my experience, is often controlled by other things, by muscles. Let's not just look at the teeth, but let's look at the musculature first. We want the muscles relaxed. When the muscles relax, we have a much better opportunity of placing a bridge in the correct position the first time. And if we have problems with the bite, leave the bridge in temporarily cemented. If possible. Hopefully we'll come up with this before we permanently cement it. Relax the musculature. If things are still a problem, then refer out to the chiropractor or the physical therapist of your choice. Get maximum improvement there before finally deciding on how you're going to treat the bite and whether the bite is going to be adjusted. Okay, I hope you found this interesting. Any questions, put in the comments section. I'll try to answer them as well as possible.